Good afternoon. I'm David Sweat, Deputy Division Director for Shelby County Health Department, and welcome to the City of Memphis Shelby County COVID-19 Joint Task Force press briefing for March the 11th. To give you an update on where we are with the numbers, in Shelby County we have had a total of 89,167 cases reported, and that represents an increase yesterday of 112 new cases in Shelby County. We have up in Tipton County, Tennessee, now crossed 7,000. We're at 7,002 cases in Tipton County, 4,706 cases reported from Fayette County in Tennessee, 19,868 reported cases from DeSoto County in Mississippi, and then 5,442 cases in Crittenden County, Arkansas. We've had 1,533 deaths in Shelby County. Looking at the state of Tennessee, we are now 786,597 cases have been reported. And in terms of vaccination doses that have been administered, we know of 194,116 doses of COVID vaccine that have been delivered in Shelby County. That represents 132,316 first doses, and then 61,800 people have been fully vaccinated with 2 doses. A couple of events that are coming up this weekend that we want to call your attention to are testing events. We have on Saturday, there's an outreach testing event on Highland Street at Iglesia Bella Vista, and that is operating from 9 a.m. to noon on Saturday, March the 13th. And then we also have in the Hacks Cross area, Poplar Healthcare will be offering testing on Saturday and Sunday. And we do want to encourage everyone who is interested in traveling for spring break, think about getting your testing, make sure you know your status. Anybody who's experiencing symptoms, anybody who's been exposed to somebody that is COVID-19 positive, please come out and get tested, either in one of these outreach test events or go through the normal community test sites, because we still have almost 17,000 test site appointments available in various places throughout the county. And it is vitally important that we don't forget to test. Although the vaccine campaign is front and center, knowing your status is the first step in controlling the spread of the virus. With that, I'm going to invite Chief Doug McGowen to give an update on the vaccine campaign.
Thank you, David. I appreciate that. As David said, we're closing in on 200,000 vaccinations administered. By the end of the day, I know we'll top that number since we have about 6,000 slated for today, and likely a few more because we're about a day behind in entering the data. So it's safe to say we'll be well over 200,000 by the end of the day today. Last week in Shelby County, we did 32,600 immunizations. That was both first and second dose. And this week, we have about 35,000 doses that we're forecasting to be completed between our 5 fixed site pods as well as what the healthcare systems will deliver, which is about 5,000. So about 35,000 all told. Wait times at those fixed site pods is under 12 minutes on average. Yesterday we were seeing wait times down around the 8 to 9 minute, and even during parts of the day there was no wait at all. So what that means is we can probably add some capacity to those sites and put a few more shots in arms. One of the things I want to make clear is that we not only are counting the specific numbers, but we're also tracking the data about who and where people are receiving the vaccine. We get the report several times a week from the Shelby County Health Department. David and his team do a wonderful job of tracking the demographics and locations. And so this week, we took a look at the zip code data. We identified the 10 zip codes where there is the lowest uptake of vaccinations across the entire county. And we selected several pop-up pods. Those are not fixed sites, but places where we will choose to go for a day or for 2 days to administer a high volume of vaccinations. And so this weekend, we knew that the data this week told us that the zip code of 38127 in the northwest part of the county. That's the Fraser area. The zip codes of 38118, 38115, and 38141 in the Hickory Hill and Parkway Village area. Those were among the lowest zip codes for uptake. And so to address that, on Saturday, we will have a pod at the Greater Community Temple at 5151 Winchester Avenue. We will administer 500 to 1,000 vaccinations. And on Friday and Saturday, we will have a pod at the Memphis Fire Academy located in Fraser, and that will serve the 38127 zip code, doing approximately 2,000 vaccinations in that area. Now, next week, we'll continue the work. We'll schedule another 36,000 new first and second dose appointments for individuals all across the county. I will tell you that many people are asking about when the J&J appointments might be available, and I will tell you they will not be available next week. Yesterday, we received word about what our allocation will be for next week, and we will only be receiving Pfizer and Moderna here in Shelby County next week. But still, 36,000 doses. I would encourage people not to wait. Get out there and get your immunization. Also next week, we will continue our work with the targeted pods. We will begin finishing up the teachers. As you'll recall, about 3 weeks ago, we did the first round doses for municipal and Shelby County school teachers, as well as the independents and private schools. Next week, we'll be finishing up the municipal schools, their second doses, and the week after finishing up Shelby County schools with their second doses. Additionally, as we had done some targeted pods in the past at Anointed Temple of Praise in the Hickory Hill area, and also at Cane Creek Church in the South Memphis area, those individuals are due for their second dose, and so next week we will be performing second round dosing at those pods. And finally, as we have been doing for the last several weeks, for seniors who receive their services, their food assurance through the Commodities Center on Bellevue, which is the Shelby County Commodities site, we'll be delivering another 400 vaccines through Commodities on Tuesday and Thursday of next week. Those are kind of the major mass vaccination sites, but I do want to be clear that that's not the only place where people can receive a vaccination. I've talked about before that the hospital systems do provide some vaccinations, the community clinics. Well, yesterday we took the very first large step in the normalization of vaccine distribution. There are more than 100 qualified providers who can do vaccinations across Shelby County. And yesterday we made our first allocation to 50 of those providers. The state will give us about 18,000 vaccine doses next week, first doses. 14,000 of those will go out to those 50 providers, and they are all across Memphis and Shelby County. I anticipate later this week we will have a map that we can show you, not just the fixed sites and the pop-ups, but the location of all of those providers. And they're made up of primary care clinics, made up of geriatric care clinics, dialysis centers, and other community clinics, and even several of the large doctors' offices are now able to receive and distribute those vaccines. So it's becoming more normalized, more access points, and that's in addition to the existing Walmart pharmacy, the CVS pharmacy, as well as some of the community clinics that you're very well aware of. We anticipate that's going to continue. We should get more vaccine the week after next, so that volume is going to continue to go up. The providers will continue to go up, and we'll post all of that on the COVID-19 website so that you can see not only where those appointments are, but for the large sites, you can schedule your appointment, and that's what I want to talk about next. There are big changes coming to the scheduling and appointment system. We have completely filled all of our appointments this week, including, I think there may be just a few slots left at Fraser for this Friday and Saturday, but essentially all of our appointments have been filled for the balance of this week. The appointments that will go live for next week on Friday at noon will now be scheduled through the state's system called VRAS. I won't talk about what it stands for because I'm drawing a blank on exactly what it is at this moment, but VRAS, V-R-A-S. It should be transparent to individuals. All you will do is click on the link it will take you to the system. And there's a couple of advantages to the VRAS system. First, it's going to ask you a few more questions on the front end so that when you go to your appointment, you're not going to have to fill out quite as much paperwork. It will all be electronically captured. That means the process can be speeded even more than it is today. Second, it will assist you in identifying and scheduling your second appointment after you have your first appointment already scheduled. And so it will remind you when it's time for that second appointment. And third, even if you're not ready for your appointment, you can register in VRAS, and the system will remind you when your phase is ready for vaccinations, and it can tell you it's time for you to schedule your appointment. That's for scheduling appointments online. Tied to that is also a shift of our 222 shot number. You will still dial the same number if you would like to make an appointment by phone, but instead of our local agents and folks from Shelby County Health Department who have been answering that phone for the last 4 months or so, I guess, now it is a state system. They have more than 750 agents. They'll be working 7 days a week, a minimum of 12 hours a day to take your appointments. And so we think that's a higher volume, higher throughput. And further, they are not just taking a note and scheduling you with a select number of appointments. They can choose from all of the appointments in the system. So when you call on the phone, it's just like being on the computer, and you can pick the appointment that you'd like. The last feature I'll talk about for VRAS is that when you enter your information into the system, including where you live, it will select for you and give you some options about the most convenient place for you to receive your vaccine. So that may be one of our fixed sites. It may also be at one of these other pharmacies that's offering public vaccinations, or it may be through a community clinic that's offering vaccinations. So you will be directed to the place that is most convenient to you. So that transfer over to the call center should be happening overnight, tonight, so that tomorrow it should be up and running. And so with that, my final message to folks before we take questions are, as David said, we are coming up on spring break and Easter. I encourage people to know your status. You learned about 2 wonderful test opportunities this weekend. We know that there's lots of vaccination appointments out there. There's a few more left for this weekend, and there will be 36,000 available to you next week. We encourage you to take advantage of that vaccination appointment. Continue wearing your mask when you're in public, and obviously social distance so that we can get through this pandemic. With that, I'll stop and take any questions you have.
Dominique Dillon, Box 13.
Go ahead, Dominique.
Yes, I would just like to know if you guys could expand a little more on the variants you guys found and released yesterday, as well as how you guys are further working to get more people to come out and get tested besides the vaccination, the testing sites that you guys have set up over the weekend.
So could you clarify the second question you asked about testing and vaccination? Which one would you like to know about?
I meant to say testing, how you plan to get more people to come out regularly to get tested.
Sure, I'll start with that and then let David talk about the vaccination, or excuse me, talk about the variants. But certainly messaging is important to get people out to come and get tested. That's why we're doing press conferences like this. We would ask everybody in the media also to share that as a part of the critical formula. It's social distancing, masking, and then testing so that you can know your status on a regular basis. We have plenty of asymptomatic testing, whether you're sick or not. And then vaccination. So if you could help us share the word about that, as David said, on the covid19.memphistn.gov, there are 20 or so sites that you can select from to go get tested. 17,000 slots available for you each and every week. We only have about 25 to 35% of them taken up. And so that is also quick, easy, and free. And we'll have a communications blast that goes out again through the mayor's office of both Shelby County and the city of Memphis to try to share the word that it's important for folks to get tested. So David, I'll turn it over to you on the variants.
Okay, so thank you for the question about the variants. And yes, there, as was reported in the news yesterday, we are seeing an increase in the number of specimens sequenced that are showing us one of the variant strains. We had only detected in Shelby County in December and January 6 specimens that represented one of the variant strains. We had a 5-fold increase in detections in February, and we continue to increase the amount of sequencing that's going on in the county. So we know that right now, at least at UT Health Science Center, sequencing is occurring, but Poplar Healthcare is also doing some sequencing, and St. Jude Children's Research Hospital is sequencing as well. So we have a lot of different partners in the community that are looking at these viruses to see do they have the genetic markers of being variant strains. So our detection level continues to increase. As far as what we're seeing, about 80% of the variants detected are the highly transmissible strain from the United Kingdom, the UK strain, the B117s. And we've had a little bit of detection also of some strains out of Brazil. And then we had a single case of a person getting a detection on a South African strain. So the system to detect these strains is very sensitive. We have a good ability to find them in the community. Now what we're trying to pivot toward with this sequencing is trying to do more of a random sample of isolates from, or samples from across the community without any skewing of the data toward those that are more likely to be variants. We want to begin to understand better the prevalence of variants overall. It's a little hard to see right now because we've been prioritizing for sequencing samples that look like they might be variants. So now we want to sort of pivot away from that as much and say, let's see in the community what seems to be the pattern circulating. And that's going to be critical for us to know, are we approaching a threshold, a tipping point that would escalate the number of cases. So we know in any community that gets up to 50% of the specimens or the illness in the community caused by variant strains that are highly transmissible, that's a tripping point or a trigger point for escalating the number of cases rapidly. And we don't really know what the mix is right now. It looks to be about 90% wild type and only about 10% variants, but we need to verify that. So we had meetings with lab directors yesterday to do exactly that, to pivot toward a sampling frame that would give us that answer.
Fred Broders, Local 24.
Thanks. Good afternoon. First question is for Doug. Sort of following up on the Fraser pop-up site tomorrow. How important, if you could just sort of elaborate further on just the importance of having these sites and the hope that the gap will be narrowed between per capita people getting the vaccinations and the hopes potentially for more fixed sites and more places to further tackle that moving ahead.
Well, thanks for the question, Brad, and we're well aware. Since the city of Memphis started this work just a few weeks ago, the disparity has changed a little bit. There was approximately 2 weeks ago, about 20% of the total vaccinated population was African American. This week it's approximately 30%. So that's certainly not victory. That's just a step in the right direction. So we are, and we do believe that opening the fixed sites in Whitehaven and in the Raleigh area are helping with that. And then there is a limited number of fixed sites that you can operate at one time just from a capacity perspective. So 5 we think is a good number for our community based on the number of vaccines and the efficiency. Then the pop-ups, I don't mean to minimize them. This is not a light adventure. This is a serious undertaking. So for instance, we will do in 2 days in the Fraser area more than 2,000 vaccinations. And then if I failed to say it also when I was making my previous comments, next weekend we will do another pop-up in Fraser because we know that that was one of the areas that had the lowest uptake. So fully over the next 2 weeks, an additional 4,000 focused right on that area. So doing the pop-ups gives us the ability to be precise and pivot and go where we see the lowest uptake. The probability of another fixed site, there have been some proposals. We are seeing what the flow of vaccine is right now, but today the capacity in the system that we have is best optimized by having the 5 fixed sites, and then each day we're doing at least one pop-up. The one thing I would like to address is that I realize there are 5 fixed sites, one in Germantown, one in Whitehaven, one in Raleigh, one at the fairgrounds in the Pipkin building, and one in Appling. If you look at those 5 sites, and then you draw a ring around each one of those sites, a 3-mile or a 5-mile ring, and then you look at the makeup of the population that live within those radiuses of those sites, when you add them all together, they reflect exactly the demographics of Shelby County. Approximately 54% African American and 40% Caucasian, and then about 6% other ethnicities and races. If you look at just the 4 sites inside the city of Memphis, so if you exclude the Germantown site, and then you look at the radiuses like a 1/2 mile or a 1 mile, it reflects exactly the demographics of the city of Memphis, approximately 64% African American, 33% Caucasian, and then 5% Latinx and other ethnicities and races in there. So the sites are representative of the community. The pop-ups give us the ability, because not everyone can get to the fixed site, to go to where people are that need it to increase that uptake. And I think gives us flexibility to partner with people in the community who are trusted and who are, have agency and can be the influencers, I guess, to use a term of art today from the social media, but influencers who can take people who may be on the fence and convert them over to vaccine recipients. So that's the direction that we're moving. We think that gives us a nimble enough tool to move around. And then I guess the last thing, Brad, I would say is, remember what I talked about a bit earlier. It's not just these fixed sites. Next week, the fixed pop-up sites will be delivering of that brand new total that we got from the state. We're only delivering about 4,000 of those. The other partners will be delivering 14,000 of those, and they are in every neighborhood in Memphis. So it's a multi-layered approach. It's easy to focus on the fixed sites, but that's not the only point of delivery.
Do you have a follow-up, Brad?
I think that's good. That was very thorough. I'll pass it to my other reporters.
Kelly Roberts, WMC.
Good afternoon. My first question, I'll stick with vaccines since we're on that topic right now. When it comes to this 1C category, Doug, can you kind of shed some light on just how big this population is in Shelby County, or exactly what the demand looks like at this point? Is the demand still very high? Should we anticipate being in this stage quite a while longer?
Sure. Well, I'll speak to it from the demand side and what we're seeing. David, as our epidemiologist, can tell us what he believes the makeup to be, but what we are seeing is still very strong demand. When we move to phase 1C, realize that we have, and I heard David talk about this on Tuesday, the age restriction is kind of removed if you have any kind of a comorbidity, and that means any kind of an underlying health condition that would be exacerbated by COVID, and there are so many of those. And so that really has opened the world of possibilities. David, I'll give you a minute to recall, I don't know the exact number, but when we were in phase 1A or 1A1, 1A2, and 1B, that was a pretty finite group of individuals. This more than doubles or triples the amount of people that were eligible under 1C. So the demand is definitely still there. I believe that we'll be there for the next few weeks at least. But I can get you a more precise number, and I promise I'll bring that back to you on Tuesday, or if you want to send me a note, I'll try to get you that number of the cohort that we believe to be in the 1C category. Did you have anything to add to that? Yeah, go ahead.
Thank you for the question. I understand the importance of that. The problem is it's a little bit harder to get a denominator on that. So if we're looking at age-based categories from census data, we know how many people in Shelby County are within different age groups, right? That's known from census data. But the number of people with comorbidities, especially chronic comorbidities, that's just not reportable. So there's not a good denominator for that. What's important is if you happen to have one of these comorbidities, in other words, if you're diabetic, you know it. If you have asthma, you know it. If you have hypertension or you take high blood pressure medicines, you know that. So if you know that you have these underlying conditions personally, and we tell you that it's now phase 1C and you're eligible, then you need to feel empowered to go make an appointment to get a shot. You're eligible. And so, but in terms of some of the age-based stuff, over 52% of people who are 75 years of age and older have been vaccinated. We still have people who are older than 75 who could still avail themselves of the vaccine. 40% of the people 65 to 74 years old have been vaccinated, but we still have a lot of people eligible there. But with opening it up to 1C, any adult or anybody 16 years of age and older who has any of these comorbidities, you're also eligible. Go ahead and make an appointment, come out, get your shot. And in terms of other groups that we would want to encourage, in addition to the geographic distributions where we're trying to outreach certain pockets of the community that are under-vaccinated at the moment, we also know, guys, we're not coming out enough. 63% of all the vaccine that's been delivered has been administered to females. Only a little over 33% has been administered among men or to men. So, gentlemen, this is time. We need to come out and get our shots.
Was there a follow-up?
Thank you so much. And David, just my follow-up is dealing with the variant strains that we've been seeing. We got a press release from the University of Memphis about the work, kind of the collaboration with you all in the U of M and some of the labs, Dr. Jane, et cetera, about containing the UK variant among some transmission that was happening within Memphis athletics. Can you shed some light on that collaboration and exactly what the result is? It sounds like you were able to kind of stop that transmission. Is that stopping the transmission across the community or just in that kind of group?
Well, of course, if you can shut it down in a cluster, you can prevent it from spreading more widely in the community, right? And so let's just, I don't want to say compare and contrast, but let's just compare the situation with another cluster outbreak that occurred at the University of Memphis in August and September of 2020. Had a very large cluster there, this wild type Wuhan, regular COVID, but it was a very large cluster. And obviously all of us learned a lot in the effort to control that. And then in February, we had a new cluster at the University of Memphis, also in the athletics department, and it was being driven by that highly transmissible UK strain. But it was early recognized, it was early sequenced, the information was shared quickly from the laboratories to the university, and the university and the health department had, building on our relationships from the summer and the last outbreak, had really gone through already what the best practices were for contact tracing and isolation and quarantine measures. And the university was able to build on their experience from the past and be very aggressive about isolating cases and putting contacts in quarantine. And then the laboratory system was invited to come in and help them with testing. A very large number of people in that department got a test to know their status. Once again, know your status is the first step. So it was a collaborative effort from many partners to just lock that cluster down. And even though it was a strain of the virus that was 3 times more transmissible, the size of the cluster was less than half as large as it was in the previous experience in August and September. So kudos to the university, congratulations to them, they did a great job.
Jane Roberts, Daily Memphian.
It's interesting to hear that the UK strain increased 5-fold in February. Is that the U of M cluster, which was in the upper 20s?
Yeah, that's part of it. And so we know we had an outbreak cluster at the University of Memphis that was driven by that strain, and a lot of those detections of the UK strain were related to that cluster. So that's where I was speaking earlier, that the sequence data at the moment is not representative of what's transmitting in the community. It's skewed toward the variant strains because of some of these experiences. So the question before us now as a community, and that we're working on trying to get a better visualization of, is how prevalent are these variant strains in the community? That's the research question that we're trying to get answers to this week.
Jane, was there a follow-up?
No, thanks.
We are.
I think we're out of time. Or we have more
It's up to
questions?
you. It's up to you. We've got a few more, but
We're at your disposal. What's your next question?
Shay Arthur, WREG.
Okay.
Shay, I think you might be
Hi,
muted.
sorry. Hi, sorry. Thanks
We
for
can
taking
hear you
some
now.
extra questions here. My apologies if I missed it, but why are we not getting the Johnson & Johnson vaccine here in our area? And any idea when we will get it?
Well, that's a good way to end this up, Shay. It's a great question. We will not receive any allocation next week. We've only received about 500 here in Memphis. The state of Tennessee has not received a substantial allocation of Johnson & Johnson. You may have read the report that they have 10,000 that are giving out in Nashville at a mass event at the Titan Stadium next week. That represents a huge percentage of what the state had received. Part of the reason for us not receiving the J&J when it came out is that, quite frankly, it's a numbers game. We are currently about 20,000 vaccines over allocated per capita here in Memphis and Shelby County. And as you know, we're working off, we had some inventory in stock and we're working that off. We anticipate, since we're not receiving it next week, we anticipate the week after we should start receiving some of our fair share of J&J at that time. But it's really about the allocation across the state and making sure that everyone has about the same amount per capita of vaccine available to administer to the citizens. But you've heard lots of news about J&J production going up, significantly up. I think we're not going to have to wait much longer than after next week to begin receiving that. Yesterday, when we made the allocation, there were, as I said, 50 providers who received vaccine. Many of those were new providers. I would have had a much higher number because there's probably another dozen or so that only wanted to work with J&J, and so they're going to wait for that to become available. So it's a really good question. As I get clarity from the state and as the state gets clarity from the federal government about when that allocation will come up, then we'll make sure that we get that out to you. And so with that, I know we're out of time. I would just like to say, finally, there is lots of opportunity for vaccination. Please take advantage of it this weekend out in Raleigh. There's a few more slots available. If not, in Fraser. If not, plan on it next weekend out there in Fraser. Plan on one of the fixed sites or one of these many partners. Look at covid19.memphistn.gov and you'll see a link that will drive you there. Take advantage of the new VRAS system. I will tell you that it is brand new. The call system is brand new. I would be foolhardy to think that it will be completely seamless, but we will work through. We have everybody standing by to make sure that we can implement the system as seamlessly as possible. So I'll ask for a little grace and a little patience on the first day. We will be the largest, by far, the largest transition into this new VRAS system that the state has encountered. And so with that will likely come some hiccups. But we will work through those with you. The bottom line is we will have vaccine available next week. So please get tested and know your status, and we'll come back next week on Tuesday. David, anything further that you have? Okay. Thank you all for being with us today.
Thanks, everyone.